my name is Isabella. I'm going to be presenting the male genitalia assessment, but before then we're going to take a patient history and then continue. So in the patient history, of course, I asked him the date of birth and allergies or anything like that. And I did ask the patient about if he has any genital urinary problems, if the patient, the sexual history, if he has had any STDs, and he said no. And any chronic diseases such as diabetes, kidney diseases, the patient said he doesn't have anything. And then any congenital birth defects, and he denied, saying he doesn't have anything. So we're gonna go ahead with the assessment. I'm just of course gonna wash my hands and put on my gloves because we're gonna be touching the male genitals and uncover the patient. And this is gonna be my penis and testicles here. So to begin with, I can assess the patient when the patient is laying down. Open up or uncover the patient up, and then expose the genitalia area. With that exposure of the genital area, I'm gonna inspect and note the dispersion of the pubic hair. It should be, of course, because it should be cause than the head one, the pubic hair. And then we're gonna inspect the penis and see if he has any lesions, any sores, rashes, masses, or anything. The penis should be normally be smooth. And then we're gonna inspect the urinary mirrors, is where they peep from, and then see if he has any lashes, lesions, or anything. It seems he doesn't have anything. And then observe, of course, the color of the penis, which is normally pink and dark or brown, and then the testes are normally darker than the body skin color. And then I'm gonna go ahead and palpate the shaft of the penis. And when I'm palpating, I'm making sure like there's no lumps, anything like that. It should feel smooth, and I say my thumb on. Sometimes when you're palpating the patient, of course, they may end up electing, but it's a normal sign. And then we're gonna inspect the scrotums of the patient. With the inspection, we're gonna make sure they don't have any masses, any drainage, any tension, or anything like that going on, any sores or rashes on the testes. And they seem that they don't have anything like that or edema going on. And then as I said, they are normally like have a different pigmentation from the body because they're a little bit darker. And then we're gonna have to gently palpate the testes of the patient. And oh, sorry, I forgot to say that normally these exams can be done when the patient is standing up. But if the patient are not able to stand up, then they'll be able to lay down. So I'm gonna palpate the testes gently for any masses, tenderness. And then usually the testes, they should be oval and equal in size, and they should feel smooth, which they do feel, and I'm doing that at the same time. And then I'm gonna go ahead and palpate each epidermitis, and that is done when you just like kind of like stretch it a little bit. Since this is not a human being, it's really hard to demonstrate. So you kind of like stretch the testes and feel the epidermis on the and it's done in the posterior lateral surface of the testes, and they should also feel smooth. And then I'm gonna go ahead and palpate each segment of the spermatic cord, ensuring that each testis does have the spermatic cord. And for that, and they also should be feeling small and smooth and untender. And then now I'm gonna be assessing for inguinal hernias. For any inguinal hernia, you just come where the testes are and kind of push your finger. Sorry, I'm gonna demonstrate to myself. Push your finger in here, and you can ask the patient to bear down or cough. If they have any inguinal hernia, you'll be able to feel when you're just like pressing inwards their testes. And then the other thing we're gonna be checking is if the patient, of course, have testicular torsion or anything like that, and that's done by just stroking thighs of the patient. Once you stroke the thighs of the patient, on the side that you stroke the thighs of the patient, that side, the testicles or they should be able to rise up, and if they doesn't, that shows a sign of testicular torsion. After doing that, so we're gonna be checking for the prostate gland, and then in this area we're gonna have the patient lay down, and mostly maybe on the left side. When the patient are laying down, you're gonna of course have some loop and lubricate your fingers and inspected the area, the back area, and make sure like if there's hair dispersion and how it does look, if there's any lesions, masses, or anything like that. And then you move your fingers towards the umbilicus, and then you kind of rotate it in 360 degrees. That's like the patient's back. Just rotate it in 360 degrees and feel it should be feeling smooth too in there, and it should feel like firm, rubbery, and smooth, and slightly movable. And then you can feel also the prostate gland in there, and then you can be able to stroke it. After that, take your gloves off and then encourage the patient to perform physical exams each morning, or each month, to check for any lesions, lumps, discharges, sores, and bumps. Then this is normally done like during shower time, and if they report of any of those lesions, lumps, or bumps going on, then you should encourage them to visit with their healthcare providers. Thank you. So I'm gonna move on to female assessment.